Septoplasty surgery is a very specific part of nose surgery that addresses a deviated septum. You've probably heard that term before. Deviated septum refers to the wall of cartilage that is on the inside of your nose, and typically that wall of cartilage is a very thin rectangular sheet of cartilage that separates the air passages on the inside. Deviated septum refers to when the septum, or that wall of cartilage, is deviated to one side or the other, bowing outwards and narrowing the nasal passage on that side. Septoplasty is the surgical technique whereby I straighten a deviated septum. Oftentimes that requires removal of a segment of cartilage from the septum, the deviated segment. By removing that section of bowing outwards cartilage, then the septum can straighten out. And by straightening out, then that can open up the airway and the airflow through that nasal passage. Most commonly, air passage obstruction or airflow disruption is caused by other reasons or other mechanisms. Most specifically, sometimes there's a collapse of the internal airway at the top of the air passages, and that may require cartilage grafts to open up the air passage. Fortunately, with a septoplasty, because we're taking out some cartilage from the septum, then I can use that removed cartilage. I don't just throw it away. I can use it to open and spread open the internal nasal passage right at the very top of the bridge. This is a specific area that oftentimes can be pinched. We can actually diagnose that in the office during a consultation by placing a Q-tip inside the nasal passage where there's the most restriction, and by stenting open the top of the air passage, in fact, that can open up new airflow. So if I do that little test and I diagnose a collapse of the internal part of the airway, then I know that taking some cartilage and placing it in that area to stent open the air passage right there can be beneficial. So in fact, septoplasty, oftentimes I'm combining with other techniques to really optimize airflow, and that's the whole reason for septoplasty in the first place.